Your DOT physical isn't always a one-and-done visit. Sometimes the medical examiner needs more information before they can make a final call, and that means paperwork from your doctor. Here's what that actually looks like and why the timing matters more than most drivers realize. When an examiner can't complete your certification on the spot, your exam gets placed into a status called determination pending. That's not a medical card. It's not clearance to drive. It just means the clock is running while the examiner waits on your records. FMCSA guidance allows up to 45 days to resolve a pending exam. If that deadline passes without an update, the exam goes invalid, and you start over from scratch. So if you're pending, treat it like a deadline, because it is one. Now, the two official forms in a DOT physical are the Medical Examination Report, that's the MCSA 5875, and the Medical Examiner's Certificate, the MCSA 5876. You only get the certificate if the examiner decides you meet the medical standards. Until then, nothing is finalized. The most common reasons examiners ask for outside paperwork: insulin-treated diabetes, vision issues, recent hospitalizations, heart or neurologic conditions, sleep disorders, and medications that could affect alertness. Each of those situations may require your treating doctor or a specialist to weigh in before the examiner can move forward. Two conditions have their own specific forms and their own 45-day rules. If you use insulin, your treating clinician fills out the Insulin-Treated Diabetes Mellitus Assessment Form, the MCSA 5870, and you have 45 days from when your clinician signs it to get it to the examiner. If you have a vision issue and you're going through the alternative vision standard, your eye doctor completes the Vision Evaluation Report, the MCSA 5871, and your DOT exam has to begin within 45 days of that signature. Miss either window, and you're restarting. When your doctor writes a note for your DOT exam, the most useful thing they can send isn't just "patient is cleared to drive." What actually helps the examiner is the diagnosis, current status, your treatment plan, your medication list with doses, recent test results if relevant, and any functional limitations. Facts, not conclusions. One more thing worth knowing: if you still have a valid, unexpired medical certificate when your exam goes pending, you may be able to keep driving on that existing card until the examiner reaches a final decision or it expires. If you don't have a current certificate, pending status does not authorize you to operate in interstate commerce. The practical takeaway: if you know you have a condition that usually triggers follow-up paperwork, call the clinic before your appointment and ask exactly what they need. Show up with it. 45 days goes fast.